Previously, we spoke about osteonecrosis, and we spoke about osteonecrosis as just a concept of its own. You understand? So right now, we're just trying to talk about the different types of osteonecrosis. So of course, when you hear osteo, you are talking about the bone. Necrosis is the blood supply to that bone is not sufficient. Do you understand? So this could occur at the hip joint. All right. So let's look at how you could present, how we can be able to treat it, and all of that application. So you see femoral head collapse. Blood supply, the blood vessels there's one or two things actually what is trying to affect the way they supply the hip joint. So what we have is this. It's also known as avascular necrosis. Okay, avascular, that means blood supply is not sufficient. Do you understand? So it's a condition where the femoral head, that's the ball of the hip joint, begins to die. Now this is because blood supply is not reaching it properly. Okay, it's a progressive disease. That means it doesn't happen all of a sudden. It takes time. You understand? So what causes it? Many things could disrupt the blood supply to the head of the femur. It could be trauma, fractures, or dislocation. All right. Sometimes side effect of steroid drugs. Sometimes it's alcohol abuse. Sometimes it's medical conditions like sickle cell, lupus, HIV, Gaucher's disease. All right. Sometimes the cause is not known. Okay. So you can see it, different stages. You could pause to look at this. So symptoms you should watch out for is if you're having a lot of groin or buttock pain, okay, and the pain is worsening when you try to bear weight. Now this will tell you that when you bear weight, a lot of the weight is resting on the hip. You understand? So if the hip is not well, you have pains. There's stiffness or reduced range of motion on that part of the body. If the person is limping or having difficulties trying to walk, right? So in early stages, pain may be mild or intermittent. Then later on, it becomes constant and pain that will make the person not be able to even move that part of the body. That's a disabling pain. So diagnosis, I might want to actually do imaging to look inside, the hip to point out the issue, like X-rays, MRI, and CT. So treatment, if it is early, just call decompression, possibly with stem cells and grafts. This will now, encourage new bone to form up. Mid-stage osteotomy. Advanced stage where total hip replacement. Don't worry, all these surgeries we get to talk about them as the lectures move on. All right, so that's it, guys.